Assalamu alaikum. My
Welcome.
name is Dr. Hassan and I am final year student of medical. Today I want to examine the movement, motor and sensory function of your hand. So can I have your permission?
Yes.
In this material. Can you put your hands in front of me? First of all, I need to examine completely his hands. Like I look for any like inflammation or swelling in the metacarpopharyngeal joints. Because it's evident if this person have any swelling or like inflammation in the joints. That's the first thing to do. You clearly examine the hand of patient. Can you move your hand like this? The next thing I want to check the sensory function of his hand. So I need to check the thinner and hypothenor muscle of his hand. When I touch your hand, you tell me, do you feel my sensation of my thumb or not?
Okay. Yes.
Can you feel it?
Yes.
Okay, this side.
Yes.
Okay, now go to right hand.
Yes. Yes. Yes.
No. Okay, good. Now we can check the strength of your muscles of your hand. So I have this card here, and first I need to check your movement of thumb. First put your thumb like me here, close to. Yeah. Now you abduct your thumb, like move the thumb away from the finger. That one. So here I'm checking the abduction of his abductor polycell muscle. Okay. Now I want to check the abduction of this index finger. So keep this finger close to your ring finger, like this. Both hands. This way. Okay. Now move your index finger away from the ring finger. Okay. This abduction is also normal. Now I want to check the nerve function. Okay. So I check for your radial nerve, like it's normal or not. Can you flex your wrist for me?
Yes.
Okay. And extension and flexion. Yeah, it's normal. So radial nerve is also functioning normal. So if we can also look for like a wrist drop. If there's a wrist drop in patient, like maybe there's a palsy of radial nerve. And you can also check for claw hand. Keep your hands like this. Okay. Front side. If there is a claw hand, maybe there's a nerve damage. Okay, now I need to place this card between your thumb and this index finger.
Yes.
No, don't allow me to remove this card from your hand.
Okay.
Here I'm checking the strength of his muscles. Okay, now next step. Can you put your thumb like this, pinching your index finger, close strongly. Okay. Then I check to move his finger apart. So if I can move his finger apart, maybe his muscles are weak. So we also check here for muscle strength. Now the final step, we check for the extension of your fingers, extension and flexion of your fingers. Can you move your fingers like this? Okay. Made a fist for me. Okay, that's completely fine. Okay. From my examination today, I checked this patient sensory and motor function of his normal hand. And from my examination, all the functions are completely normal. His muscle strength is very good. His accommodation is also good. And his extension and flexion of joint is also very good. So that's my conclusion. Is perfectly fine. Thank you.
Send the center so that I can take a picture. Okay, thank you. Good job.